Hi, this is Dr. Jim Lynch from the Stellate Institute in Annapolis, Maryland. One of the questions we frequently get asked is, do I need to be sedated for the Stellate Ganglion Block procedure? This comes up all the time. There are providers around the country who offer sedation. Sometimes they call it twilight sedation for this procedure. I can tell you that from our experience here at the Stellate Institute, treating thousands of patients with Stellate Ganglion Block, we have never sedated anyone, and I would highly recommend that no sedation is not necessary. It's actually one of those very, very clear things to me that if somebody asks me, do I need to be sedated? The answer is no, absolutely not, period. If somebody said, well, could I be sedated? Is that the kind of thing I can opt to do? I would strongly discourage anyone from doing that. Why would I say that? We treat people with significant anxiety symptoms that come with maximum scores of 21 out of 21 GAD-7 scores with just anxiety, even leaving the house. I can tell you that over the years, treating people with significant anxiety coming to a doctor's office or any type of procedure do very, very well with this procedure without sedation, with just taking our time, answering all questions, allowing our patients to be very comfortable in a comfortable setting, and taking our time and going slow without a bunch of scary hospital setting type atmosphere going on. And people do very, very well with this. That may sound hard to believe, but it's quite reassuring when virtually every one of our patients, when the procedure's over, says something like, that's it? And they're just shocked that it's not scary or painful or uncomfortable, aside from maybe a little bit of a pinch like you might feel before getting a flu shot or a COVID shot. We use a tiny little needle that is seen under ultrasound guidance. We use ultrasound to steer our needle away from anything that's potentially sensitive, and that allows for a very easy, low stress, low pain procedure. Why else should you not be sedated? Sedation has risks, so it sounds appealing in that, well, I don't want to feel anything, but sedation is always a serious consideration. There are medical risks associated with that. It's not extremely risky, but there is certainly not without risk. There's a risk of having things like your heart rate drop and bradycardia, which is a risk of about 7 in 1,000 people will get bradycardia from sedation. About twice that many will drop their blood pressure and have hypotensive urgencies. And really about 40 out of 1,000 people who are sedated will have an issue with dropping their oxygen saturations, require oxygen. These are not small numbers. These are actually common occurrences. They're not always life-threatening, but there's still something to consider. So to us here, both myself and Dr. Mulvaney at the Stellate Institute, we just feel no justification whatsoever to put someone at risk of those types of things for a procedure that takes just a couple of minutes, is not painful, and has tremendous benefit to people. So we feel quite strong that sedation is not necessary and would not encourage that at all. The second reason why sedation is unnecessary and can actually be counterproductive, in my opinion and in my experience, is that when you come out of sedation, you're a little groggy and you're trying to get your wits about you, and it's not clear what you're feeling. You may feel better after the Stellate Ganglion Block. It may be difficult for you to sense that in a clear way. If you're not sedated and you have the Stellate Ganglion Block, you're wide awake during the time. I talk to you during the procedure. I ask you if anything's bothering you. You tell me no, and then after just a few minutes, the procedure's over. And immediately after that, you may notice something. This is important because this is something that with perfect clarity of thought, you're able to recognize something just happened, and it has nothing to do with anesthesia or anything that may have clouded your mind from sedation. This is something where when your sympathetic nervous system is turned off, many people have a tremendous release of emotion and will feel something dramatic and impactful simply from the ropivacaine turning off the sympathetic nervous system and allowing their normal state to come forward. This may not seem obvious to people where sedation may seem appealing, but I would tell you that this is a dramatic thing that also is a kind of a secondary reason to avoid sedation. I hope that answers the question. Thank you very much.